Dr. Gebreyesus, how do you assess the COVID response in Africa?
I think the COVID response is going okay. The first wave was better for our continent, for Africa, actually. The second phase was more serious. That started in January 2021. And then there was a period of starting from late January, started to decline. And now we see some tendency again to increase. We need to do the basic things like what we have been doing, the use of masks, the physical distancing, the hand hygiene, and we need to continue to do that. And we need to continue our surveillance also. We need to find where the virus is and try to attack. So continuing with the public health measures will be important. But I have some concern that there is a slight increase now. It's not a significant one, but the tendency should be taken seriously. But this is not just for Africa alone. If you see the global trend, it was declining until mid-February. And now we can see the last 3 weeks, some slight increase. This could be explained in many ways. As I said, maybe some countries are lowering their guard, that they have to be very careful. Second, it could be the variant, and there could be other issues. So we have to understand why.
Although the continent has not been spared by the deadly pandemic, Africa has seen less cases of infections and death compared to the rest of the world. What do you make of it?
I think the combination of many factors actually help. One, the population is young. And second, Africa actually started as early as possible, preparing itself and responding. The early action was not just individual country level only, but it was a continental-wide coordinated effort. That also helps. And the fourth is Africa, our continent, is regularly challenged by many infectious diseases. It could be yellow fever, meningitis, cholera, Ebola, you name it. So the primary health care or the public health system is better prepared, so it can respond fast.
South Africa President Cyril Ramaphosa was appointed as the African Union champion for the COVID-19 response. The country has been hardest hit in Africa by COVID. What is the significance of his appointment for the response on the continent?
I can say that he earned that position or that championship because of what he did in the past 1 year. One of the reasons I said why Africa did better is because of the quick action. And this would not have been possible without his leadership. As you know, the past year he has been chairing the African Union. And I remember the first meeting, I attended that meeting, and to design a continental strategy. During that time, there was only one confirmed case, I think, in Egypt. And he pushed for that early, quick response. And that meeting resulted into a continental strategy. And then he formed a Bureau of Leadership that's composed of regional leaders from all corners of our continent. And then he immediately appointed special envoys that can take care of the supply of medicine, mobilizing resources, and people who can lead in other efforts. Very renowned Africans, actually, as special envoys. But not only continental, but he also was leading the global effort. As you may know, South Africa and Norway, President Ramaphosa and Prime Minister Erna Solberg co-chair the Facilitation Council of the ACT Accelerator. And he contributed also to the global response. I'm very proud of President Ramaphosa on what he did, and that's why Africa really fared well. And I know through this appointment he will continue to to lead with his colleagues, heads of state, heads of government, leaders in our continent.
We are seeing COVID-19 vaccines being deployed around the world. What do you make of the access to vaccines across the board, and especially in Africa and developing countries, and the role of COVAX?
The COVAX started, as you may know, as ACT Accelerator with two objectives. And the two objectives were, one, to accelerate the development of products like vaccines, diagnostics, and therapeutics. And the second objective was fair distribution. I think the first objective is achieved. As you know, in less than a year, we have proven vaccines, diagnostics, and also treatments. The second objective, especially fair distribution, is facing some challenges, especially with regard to vaccines. The first challenge was high-income countries, some high-income countries, not all, started vaccination in mid-December, while the first country, for instance, that received the vaccine, which is Ghana, is in late February. And from WHO side, we were raising the alarm, saying this is not right, and we should really share, and the only way to end this pandemic is by making everybody safe. So equity of vaccines is in the interest of all of us, in the interest of all countries. So anyway, we started now the vaccination also in low-income countries, and the number of countries who are receiving the vaccines through COVAX is actually on the increase. So we're now working on narrowing the gap by increasing production. And production can be increased by, making use of all the manufacturing capacity we have globally. It could start from voluntary licensing, compulsory licensing, technology transfer, and including intellectual property waiver based on the provisions of TRIPS.
Now, Dr. Tedros, having access to vaccine is one thing. Getting people to get vaccinated is another thing. And we have seen a lot of issues around vaccine, with vaccine hesitancy, vaccine distrust. What are your thoughts on this issue and what can be done about it?
We need to understand why those who don't want to take the vaccines are saying this. Most of it could be because of misinformation and disinformation, and we have to address that. And we have a very strong partnership now with the tech industry, and to address some of the misinformation which is circulating in the social media. So trusted sources can have the presence in the social media so people get the right information. And the other is, leaders should be at the forefront to show that these vaccines are safe and effective. And I have seen many leaders, heads of states, heads of government in our continent who have been taking the vaccinations, at the launching of the vaccination, which really encourages the citizens to follow.
And finally, Dr. Tedros Adhanom Gebreyesus, the USA recently rejoined the WHO after an exit by the previous administration. What are your thoughts on this decision and how big a difference the US return to the WHO will make in the future fight against COVID-19?
This is very, very telling how committed the administration is to global health and to multilateralism. As you know, HIV/AIDS pandemic was a major global health problem, and the U.S. leadership and support and the global role was very crucial. As you know, through the President's PEPFAR initiative and HIV, when drugs were made available actually to developing countries, and also support in other ways, and also through Global Fund, its leadership is really key, and it has shown it in the past. And in the pandemic now, this unprecedented COVID-19 pandemic, we expect that the U.S. will play its global role too, and that's what we are seeing now. And we have good engagement, good partnership, a very constructive one. We hope the world will benefit from it, and the U.S. will also benefit from it, because it's by working with others that U.S. citizens could also be safe.
Dr. Tedros Adhanom Gebreyesus, thank you so much for joining us. We appreciate your time.
Thank you for having me.